Hi there. This is part 2 of the last video I did. I was in my car yesterday and kind of giving you a little summary of some labs and just going over the grieving process and re-grieving over and over and over when you deal with illnesses that more pile on as you are coping with the current ones. So just wanted to let you know that the crazy thing is, like yesterday I said, I had just this overwhelming sense of peace. Woke up today, went to my gastro doctor. He's one of my favorite doctors. He's like super thorough, really knowledgeable, super kind, really like laid back and chill and takes his time with you and is just very realistic. He looked at all my labs, looked at all my pictures, everything I sent, checked my stomach, did all these things, and, you know, basically like evaluated the whole situation and, ended up basically saying that, you know, the inflammation markers are most likely high, or the marker is because I just have so many inflammatory conditions. So mast cell and then like IBS and who knows with fibro, nobody really knows. I feel like most people with fibromyalgia, they have some component of inflammation. It just seems like, how could you not? Because for me, it feels like there's a combination of nerves and muscle involvement and pain and all that. So anyway, instead of like starving, because that was my plan, was to just drink. So yesterday I had breakfast. I didn't feel good because I ate. And so I basically drank 1.5 little Orgain shakes, like protein shakes. And then this morning I could only drink half of one. I didn't feel good. So just from eating makes me feel kind of sick. So I went to this doctor. He said, you know what we're going to do is put you on, how do you feel about going on Xifaxan, which is an antibiotic that is used for not only Sibo, which is small bacterial overgrowth, and other gut infections on top of IBS. It helps that too. I said, sounds great, because every time I take it, it works for me. So he gave it to me. Of course, insurance does not cover it, so he gave me 3 days worth for breakfast, lunch, and dinner. He said, do not eat. So he said, eat with it, take it, you know, just don't eliminate anything crazy. The reason he told me that is because I'm already pretty much gluten-free, dairy-free, like really clean eating, except for like an occasional Chick-fil-A or Chipotle meal. So in general, I eat pretty good. And he's like, just don't obsess over trying to like figure out what's causing it, because you've got histamine issue, you've got, you know, all the things you're doing and you're already doing to treat. You're going to have flares no matter what. He said, on top of the fact that you're in your 40s, you're dealing with perimenopause. Hope that once it goes through, that it will be, it says as small as $0 copay. We're going to find that out. I don't know. All I know is that cash price is $1,600 or more. For this medication. It works really good and I really do need it. So I'm really hopeful that this copay card is going to work. So I did want to say that what my gastro doctor is basically saying is, because you're a woman, you're in your 40s, you're dealing with fluctuations and all of that of hormones, that also when your estrogen is going up and down and things are happening, which I don't know if you know this, but I've had a hysterectomy. I have one ovary, and I'm not in menopause, but just getting there. So perimenopause. And so I'm on a low estradiol patch, which helps a lot to manage all that. And basically he's saying that because you're a woman, like with all these things fluctuating, that you're going to have, in addition to all your other conditions that cause gut problems and inflammation and issues, you're going to have these flares of gut stuff. And he's like, now that we've basically like done everything, looked at everything ever, endoscopy, colonoscopy, all that, he's like, instead of like trying to change your diet and looking for some new thing to do, let's just treat your symptoms as they flare with what we know that works. Ding, ding, ding. Yay, right? So I'm good with that. I'm very happy with this idea. I rather do that than like go on this like whole other bandwagon of something else and searching for something more, because I've searched it all. They've done everything but an autopsy on me. Obviously, I'm alive, so I can't do that, but literally. So that's where I'm at. So I share this because I have complete peace. I had peace before I went into the appointment. Now I'm even more at peace about it. I've already used the medicine before. I know it works. I'm not going to have to like flip out over why my stomach looks like, if you've ever seen a Teletubby, it is a animated, like, actually no, it's not. It's like these characters in costumes, I think. Possibly animation, I don't know. From like I think like the late 90s or early 2000s. And if you could just picture that with a top knot bun, that is how I look. I look absolutely ridiculous. I can't close my pants, which is very strange when just 2 weeks ago my clothes fit. So, you know, not being able to close your pants over inflammation is very uncomfortable. And not only uncomfortable, you just feel like disgusting. So, long story short, moods change, feelings change. Things can be resolved if you don't freak out and just lay there freaking out. I went to my doctor. I got to the bottom of it quickly. I'm getting the medication. I'm going to feel a lot better because I've already been on it before and I know it works. So I'm very happy about that. If anybody is dealing with gut stuff and they don't understand like what's going on and they're not getting answers or they want to narrow it down, I have a bunch of videos on my channel here on Sibo, S-I-B-O, small bacterial overgrowth, kind of explaining what it is, how to test it, all that kind of stuff. I also have a few videos on gastroparesis, which is where the stomach, basically like the function of the stomach is slow, like really slow. So when you eat your food, it just sits and sits and sits instead of moving in the few hours as it should. It might sit for like a day or many hours or 2 days or whatever, making you very sick. I've been through that. I still have it. It comes and goes. IBS as well, functional dyspepsia, and a bunch of stuff. So if you have a issue with gut, I've got lots of videos on that, and I feel like learn something from it, take something from it, and go see your doctor and figure it out, because being a woman and dealing with gut issues is so complicated because you have a uterus, usually, unless you had a hysterectomy. You have ovaries, you have other things going on, and you also have hormones that all come into play with the stomach. I had a huge abdominal issue. It was killing me, and I had a pelvic floor issue, and it had nothing to do with my stomach, but it's all connected, and it affected my gut. Mast cell activation syndrome causes a lot of gut issues. IBS, and then endometriosis affects it, and just so many things affect the stomach that are not even gut related. And there's a lot of these conditions that everybody thinks that the gut is the source of the problem. So like you clean your gut, leaky gut, heal the gut, perfect gut, and you're healed of all your diseases. Well, sometimes yes, and sometimes no. So the better my gut is, the more I have it under control, and I do the probiotics and all the right things that work for me personally, and my gut's in the best condition ever, I still have problems. I still flare. I still have IBS. I still deal with stuff. It's never going to be just perfect, and I still have all my conditions. Now, when my gut is at the worst, everything gets super inflamed and everything's worse. So it's kind of like works hand in hand together. So yes, when it comes to gut, get it as healthy as possible, as non-leaky as possible, as microbiome balanced as possible, and calm and relaxed as possible, because when you're in that state, everything else just feels so much better, which is true. But we can't blame everything on the gut sometimes, especially, trust me, I've been working with Mayo Clinic and functional medicine, and I've been working on my gut for 12 years. You would think that if it was just right, I would have no health problems. Not so for me. So if you're working on your gut, you feel like you failed yourself because you have not cured all your diseases or illnesses, it's not your fault. Sometimes just we deal with stuff. So anyway, I don't know, I have a lot of peace right now. I feel like the medicine's going to be great for me, help me feel better, and I don't have to dwell on it and wonder why I'm so swollen, and it should start kicking in. So I'll keep you posted, because if you do feel like you need Xifaxan, I'll keep you posted on how it works for me because it always has worked for me. I've taken it 4 separate times for different things. I've also dealt with H. pylori, E. coli. Like if there's a gut condition to deal with, infection, bacteria, or even like a physical issue in the gut, I've dealt with a lot of it. I don't have Crohn's disease, I don't have colitis or anything like that, but I do deal with these other things. So if you feel like you could benefit from that, please click and subscribe. And I hope you're doing great. I hope the last video, you could relate to that in some way and know that, when you're at your lowest, that I just look at this like on my worst day, there's always something better. And then on my best day, I can't look, there's always something worse. I just look at my best day like today's a good day for me. I am bloated, but I don't feel like I have abdominal pain. I got my fibro issues today. I've got a lot of, I think it's called allodynia. It's where you're just super sensitive on the top of your skin, and it's just my nerves being hypersensitive, which is probably also playing into my gut being so swollen. So yeah, I'm in a flare, but I'm not like in bed or super sick and weak today, thank God. So I'm enjoying my peace today, and I'm gonna have my therapy appointment very soon after I walk my dogs, and I'm looking forward to that, and just trying to thrive more than survive. So God bless you all, and bye.